So it seems everywhere we turn at the moment there is talk of the evils of sugar, and among all the debate and discussion about whether to tax it or not, there is one clear message: it's not good for us and we should be doing more to restrict it from our diets and the diets of our children. So as the adults continue to talk tax, what do the kids make of it all? Fair Go's Mark Kreisel took the issue to the classroom.
First up, the Primo chocolate milk. What do we think?
7. 14.
I think that's disgraceful because, considering our health, but, yeah, companies need to make money, so...
And what about lemon and pyroa? LNP, a Kiwi classic.
18. 18.
The results are in.
82.
Now, what do you think about that?
Wow.
That's too much.
Ridiculous.
That's disgusting.
So does that change your opinion on whether you drink it?
Yes, I would never drink that. Never.
So let's put it to the vote.
If you think it's a good idea to put these labels on the bottles, put your hand up.
Short and sweet, teaspoon labels win
pretty unanimous.
in a landslide.
It would be better for everyone.
Although remember, this will be a battle for hearts as well as minds.
Can we have the drinks?
It's about to say they're pragmatic, but then they wanted to drink them. So let's talk more about tax or lifestyle regulators. Do they actually make us healthier? A Health of the State report released overnight by the New Zealand Initiative says no. Joining us is its Executive Director, Dr. Oliver Hartwich. Good morning to you. And I know that this is a lengthy, detailed 50-page report, but briefly, on what basis do you conclude that fizzy drink taxes don't work?
Well, we all agree, of course, that there is a problem with sugar and there is a problem with obesity. But we think if you're introducing regulations, if you're introducing new taxes, you should be able to make a case for that they actually work. And you should be able to show that they actually reach their target, which is reducing obesity. But when it comes to sugar taxes, what we do find with sugar taxes is they might reduce the consumption of some products, but they might not actually target the problem itself, because people will then find other products if they want to still get their sugar kick.
So those who have been advocates for the tax that point to Mexico and say it worked there, is it that it only reduced the consumption but did nothing about the waistlines?
Well, I think the problem with Mexico is actually that this experiment has only been going for 1 or 2 years, really. It's very early, really, to tell whether they will actually work. Take another example. Have a look at the UK sugar tax that they're introducing now, and you can see the problems with sugar taxes, because actually it's not a sugar tax, it's a sugary drinks tax, a fizzy drinks tax. But, for example, it doesn't apply to milk-based products, it doesn't apply to fruit juices. Now, we know, of course, that these products also contain sugar, so unless you really tax everything that contains sugar, which is practically impossible, you will not have the desired effect, because people will always find substitutes and alternatives for sugary drinks.
What about the other benefits, though, of taxing something that has serious health consequences, like raising the tax revenue to deal with those health effects, which we know are overwhelming the health system at the moment?
Well, the problem with this kind of so-called tax hypothecation is actually that it doesn't really work that well, because once the tax actually goes into the general budget, it can be basically spent on anything. If these programs that you are talking about, the education programs, for example, for health programs, really, if they make any sense, you should be doing them anyway. You shouldn't wait for a sugar tax to give you revenue for that.
Can I just be a cynic for a moment? Does this report very much come from an ideological standpoint? I read in here, it says this report unashamedly takes liberty as the starting point for analysing regulation, that paternalistic regulations need scrutiny, that there are little grounds for protecting people from decisions they freely choose. So are you always going to conclude that taxing something, protecting us from ourselves, is a bad thing?
No. I'm not ashamed of taking liberty as a starting point. I think that's what we should be doing. What we're saying is we're taking that as a starting point, and if you then try to limit individual people's liberty, if you're trying to limit consumer sovereignty, you should be able to make a case for that. You shouldn't introduce these regulations lightly. They should only be introduced once you have actually completed a proper cost-benefit analysis. And we have not really seen evidence that the taxes that are currently being discussed really work.
If once again, though, I can stay with the cynical line, the New Zealand Initiative is business funded. Are any of your business funders from the food and beverage industry who might want you to say, don't put a tax on sugary drinks?
Yes, but we're not an echo chamber. Actually, once we put out these reports, we also have members who completely disagree with us. Actually, there is a widespread difference of opinions, really, between members of the New Zealand Initiative. Not all members would probably agree with that. This is our report, this is our opinion. We just aren't convinced that there is evidence for these taxes.
So what do you think we should do? Are there other alternatives?
The alternative, I think, is actually to have a proper conversation about it, more education. And I think the education has to begin, as in your report, with kids. It has to start in families. It has to start then continue in schools. This is where we have to have a debate. This is where we have to talk about healthy lifestyles, and we just have to be very transparent about how we should lead our lives. Doesn't mean that we have to introduce taxes, because we are simply not convinced that they will work.
It's obvious there's no silver bullet. That much is clear. Thank you very much,
Thank
Dr.
you.
Oliver Hartwich from the New Zealand Initiative.